actually works in the daycare. She works with my mom. My mom's the daycare manager, and I really love what she said when she talked about, you know, she has a nursing background, but now she helps with language retention and revitalization in our community. And what she maybe was conveying to me was, like, you know, medicine and healing come in not just clinical applications, but in holistic ways. So Enoch is a champion of revitalizing language, and when our nation members and our young people speak language, they're healing at the end of the day. So, you know, today we have a great announcement, and it's on a surgical center, not technically a hospital, but a surgical center. And it's a great day to be an Enoch Cree Nation member, but you know, this can't happen with without a whole bunch of partners, AHS, Surgical Centers Incorporated, our Ballad team, and a whole bunch of other stakeholders. And forgive me if I didn't mention a few, but the primary also partner for us is the government of Alberta. So on behalf of the government of Alberta, I invite my friend Premier Kenney to come up and speak on behalf of the province.
Nanji, thank you so much, Chief Morin, for welcoming us here to the Enoch First Nation and on Treaty 6 territory. And thank you, Marilyn, for opening us with that beautiful prayer and reflection. You're the real VIP here. And that was a wonderful way for us to start a very exciting announcement that I have been waiting for over a year to see, but really 3 years. This is the culmination of a vision about how we can improve healthcare for Albertans, get people the care they need more quickly, do it more efficiently, while also supporting the ambitious economic goals for development and social development here on the Enoch First Nation and Indigenous communities across Alberta. I'm so happy to be joined by Alberta's fantastic Minister for Indigenous Relations, Honourable Rick Wilson, and our Minister of Health, Honourable Jason Kenney, and the hardworking, intrepid MLA for this area of Drayton Valley, Devon, Mark Smith. And thank you again to everybody from Enoch and other visitors who are joining us for this exciting announcement here today. Today we mark a tremendous step forward in the province's effort to reduce surgical wait times and get Albertans the care they need when they need it. In the last election, I committed that our government would launch a surgical wait times initiative in our platform that would use an innovative reform by doubling the number of surgeries that we contract out to be performed in chartered surgical facilities, which are done at lower cost than in the government hospitals, meaning we can do more surgeries, meaning we can reduce the surgical wait time. But on top of that, our government has invested $900 million in dedicated funds to perform more surgeries. We inherited in 2019 some of the longest surgical wait times in Canada, and of course the COVID crisis caused here and across Canada and around the world the postponement of many surgeries. The good news is that we are getting on top of the COVID era surgical backlog, but we still need to make major gains to reduce the pre-COVID surgical backlog. Too many Albertans are waiting for too long to get surgery, often in pain while their medical situation deteriorates. And if we look back to the beginning of the opioid addiction crisis in North America, much of it began with people waiting for surgery, taking sometimes addictive painkillers, and that too has created a public health crisis with respect to opioid addictions. That's why it is urgent that we put patients, not politics and not ideology, not special interests, but patients at the heart of the healthcare system and get them the care that they need using innovative reforms like Alberta's Surgical Initiative. We're already seeing some great success with this initiative, which has reduced cataract wait times in Alberta by 40%. That was the first major procedure that we incorporated into the Alberta Surgical Initiative, and it's showing great progress. So it really is great news that today we're building on that success. I am pleased to announce that Enoch Cree Nation, in partnership with Surgical Centers Incorporated, is the preferred proponent to offer Surgeries here in the Edmonton region. While the contract is still being finalized, we anticipate that this agreement will offer an additional 3,000 much-needed orthopedic surgeries here in the Edmonton region. Traditionally, chartered surgical facilities haven't performed hip and knee replacements since many patients need to stay overnight after those surgeries. But I can say that Enoch Cree Nation and Surgical Centers Incorporated have stepped forward with a very strong proposal to accommodate more complex surgeries while following the stringent standards of care that we expect in Alberta. This innovative reform will mean more surgeries that will reduce the wait list and get people the care that they need much more quickly. I understand that it may be the first surgical facility of its kind to be built on a First Nations reserve anywhere in Canada. And I want to give a big shout out to Chief Morin and his council for their vision and leadership. When Chief Morin first saw us propose the Alberta Surgical Initiative, he was all over me to say, we want to be the host and we want to demonstrate a new model of what he called sovereign healthcare. The idea was that First Nations would be a natural host for the increased capacity that we are building through surgical centers like this in partnership with the private sector. And that's why we responded with $50,000 grants to 6 First Nations to conduct a needs assessment and develop proposals to take part in the Alberta Surgical Initiative. So, Chief Morin, how about we give a big round of applause to him for his leadership and vision on this? Now, Chief Morin knows very well, as a good leader, that it's the squeaky wheel gets the grease. And so when he was being held up by bureaucracy, I know you'll be shocked to hear that there's a bureaucracy at Alberta Health, he was contacting me, we need to get this deal done. Thank you, Chief, for being persistent and also a little bit patient. For many residents here at Enoch Cree Nation, it will mean that they can have these surgeries performed right in their own community. And I know we'll all have to be a bit patient while construction happens, but the doors will be ready to open in just a little over a year. And now, in developing Alberta's surgical initiative, we made sure to engage with First Nations communities, as I mentioned, with those grants. And Enoch's submission obtained the highest overall evaluation and offered a competitive bid with overall lower surgery cost and lower overnight stay rates than competing proposals. I know that many remarkable community members are bringing their expertise into this project, and they're here today, so I'd like to thank all of you for taking part in this important reform in Alberta's surgical initiative. This facility, you can see pictures behind me, will be a great benefit on so many fronts, a win-win-win. It will be a win for patients waiting for too long for orthopedic surgery. It will be a win for other patients waiting for surgeries, because the more orthopedic surgeries we can perform in chartered facilities like this, the more beds will open up for more complex surgeries in our hospitals. That's a win for our medical staff and our healthcare workers who want to treat people within clinically accepted timelines. And it's a win for the First Nation here, demonstrating being a partner in prosperity by welcoming this initiative. This will further increase the number of surgeries performed in Alberta overall. And I'm proud of this partnership to bring positive change. I'm looking forward to visiting Enoch Sovereign Medical Campus once construction's complete and it's ready to receive patients. I hope this will be the first of many more opportunities to collaborate together on great projects like this. And with that, I will invite Minister Copping to add some more details.
Thank you, Premier, and good morning, everyone. Chief Morin, thank you so much for hosting us here on your land as we mark this important day together. And Marilyn, thank you so much for sharing a bit of your story and for your kind prayer. Friends, I'm honored to announce that Enoch Cree Nation, in partnership with Surgical Centers Incorporated, will be a partner in our priority work to improve Alberta's surgical system. Just over a month ago, I spoke to all of you about how we're moving forward to keep our promise, to make Alberta's surgical system the best it can be, and to give every patient their scheduled surgery within wait times recommended by medical experts. That announcement focused on more cataract surgeries and other eye procedures at chartered surgical facilities, a 25% increase in the number of procedures. And today we're here to take another step, a new agreement with the Enoch Cree Nation and surgical centers to provide more hip and knee replacements, 17% more than currently done in the Edmonton zone. This project is a step forward for our health system and for all Albertans. It's a step forward for Enoch Cree Nation, and it's a step forward for the honorable partnership between the nation and the government of Alberta. I want to again thank Chief Morin personally for his leadership, his perseverance, and yes, for your patience. And the bottom line is people are waiting far too long for hip and knee replacements. We need to do a lot more of them, and this is going to help us get it done. Right now, there's about 22,900 patients are waiting for orthopedic surgeries. That includes 8,000 who need new knees, 4,000 who need new hips. And around 60% of them are waiting far too long. 57% of the patients who need hips are beyond the 6-month target, and 65% of patients who need new knees. The wait for hip or knee replacements is a problem right across our country, and it has been for many years. We needed to do a better job long before the pandemic, and that's why we campaigned on reducing the wait times in 2019, as the Premier demonstrated in our platform. But then COVID-19 came, and it made the problem much worse in Alberta and in every other province across our country. It's hard to overstate just how much disruption it caused. In fact, tomorrow, CIHI is going to give us a look at it with their annual stats on hips and knees for 2020 and 2021. The details are under embargo, but here's a simple point. Volumes of hips and knees in that year, 2020-21, range from 0 in some months to 120% and 130% normal in other months. This disruption was enormous right across the country. Alberta actually did a little better than the average with a lower overall drop in volume and a stronger recovery, but the fact is COVID-19 put the health system through the ringer, including patients waiting for hips and knees. So we need to get the system back to normal, and I'm glad to see we're almost there. AHS is doing near normal volumes of surgery overall, about 95% of the normal level, and the wait list is down, below 71,000 compared to 68,000 before COVID and a peak of nearly 82,000 last fall. But the normal we had before COVID was never good enough. People were waiting far too long for hips and knees before the pandemic, and they're waiting even longer now. So we're going to fix it. We're going to fund more surgeries than ever before COVID, and we're going to drive the wait times lower than before COVID. In fact, they're lower than they've been in decades in Alberta or anywhere in any other province. That's our target, and we're going to get there. We're going to fund those surgeries in hospitals and in chartered surgical facilities like the one you see behind us. Now, as I said before, whether a surgery takes place in a hospital or a chartered surgical facility, it's publicly funded health care. The difference is a CSF can be more convenient for patients and more efficient. In fact, the cost is about 20% lower for these orthopedic procedures than in a hospital. And I'm not sure whether you made a call and you're going to charge parking or not, but I know they charge parking at the hospitals, which is a complaint I hear from time to time. Now, funding more surgeries in specialized community clinics frees up the space in hospitals to do more complex surgeries. And we're expanding and adding operating rooms in hospitals in Calgary, Edmonton, Edson, Grand Prairie, Lethbridge, Medicine Hat, and Rocky Mountain House. Budget 2022 provides $133 million over 3 years to do just that. And today's announcement builds on the success we've had in cataracts, and we're going to keep on building. AHS will put out RFPs for more surgeries, including expanding hips and knees beyond Edmonton and Calgary. And in the short term, while the partners build the new clinic, we'll look at every option to drive volumes up and wait times down for patients waiting in Edmonton and in the north, as well as across the province. And that may include contracting more procedures from the 2 clinics in Edmonton that do some orthopedic day procedures under contract today. And of course, AHS will keep driving volumes in hospitals up as fast as they can. They're still under pressure from the current wave of Omicron, but as it recedes, they'll be able to put more staff back into the ORs, and we'll support them in extending hours and any other option that's feasible for them. We'll also press ahead with the work we're doing to improve the overall surgical system and make it more efficient with advice from our new dedicated surgical recovery lead. That includes things like streamlining referrals and looking at new rapid assessment models to avoid bottlenecks and make sure we maximize volume for every surgeon and OR team. Managing patients better to make sure they get alternate treatment if it's a better option, and focusing the booking system on patients with the longest waits. I'm very excited to see how we're gearing up the Alberta Surgical Initiative as part of our work to add capacity across the entire health system. We promised Albertans that we would strengthen the system, and we are delivering on that promise. And today, I'm honored to welcome Enoch Cree Nation as a partner in doing just that, for the good of the Enoch Cree and for the good of all Albertans. Thanks again to Chief Morin and everyone involved in this project, and I look forward to celebrating the opening and the first surgeries in hopefully the very near future. And now I turn it over to Chief Morin. Thank you.
Put me on the spot. No, we're not going to charge for parking. And Costco is just across the street. You can get the cheapest gas in the city, apparently. Well, again, just, Minister, thank you, Premier, honored guests, and Muskegee Oche. Muskegee, there's Muskegee Trail. We are Enoch Cree Nation, but our traditional name is Muskegee, Land of Medicines. And I've said this before, it almost feels like, in the revitalization of reconciliation, we're doing our own reconciliation within the nation, and going back to our traditions means we're going back to traditional words and names, and Muskegee, Land of Medicines, almost feels like we're meant to be in this sector, leading the way. Pandemic, status quo, the minister spoke about it, our surgical wait time initiatives, everything that's going on in the healthcare sector, and, I can't think enough. I was in the Stollery last week for 7 hours, and with my daughter, and she's fine, but just watching our healthcare professionals work their magic and the work that they do, and the pandemic being such the challenge that they faced, and they're pulling through it, I can't give enough thanks to them at this time as well. But talking about the Surgical Wait Time Initiative and our project and our partnership today, it really hits home for a lot of us. So, Chase is in the room, and our grandpa is in Kapotagao, Alexander First Nation right now. He's in a seniors care, continuing care facility in another First Nation, and I thank Grand Chief, because that's Grand Chief's First Nation, where he's at, for taking care of our grandpa. He's just about 80, and he's there waiting for hip surgery. He has to go there because my grandma, who's 82, can't live with him in the house because they can't take care of each other. So he's on that wait list, just like a whole bunch of Albertans. So it hits home for us. And my father-in-law, he's 82 as well, and he's from high-level Deneta, which is about 700 kilometers away. And recently, he needed some surgery on his eyes as well. And, my father-in-law's first language is Cree and Dene. He's lived in the bush in northern Alberta all his life. And so when he has to come to the awesome facilities we have in the city of Edmonton, like the U of A, it's intimidating for him. It just straight up is. And that's trouble. He has trouble with accessibility, he has language barriers, and he has other immobilization issues that don't make that experience for him the best that it could be. He got his surgery, and they treated him really well, but, I was having a little bit of a debrief, and what if you can get that on the First Nation, because, would it make a difference? And he said, absolutely it would. We talked a little bit why we're doing this. And, we were reading a recent Canadian Medical Journal Association report recently, and this is no surprise to everybody. 5 to 11 years shorter are First Nations life expectancies. This specific journal article that we were reading and study was post-operative outcomes for Indigenous peoples, and to no surprise again, they are poor compared to the Canadian and Albertan average. Systematic review is needed according to this journal article. And that's still going to take some time, but, reconciliation sometimes means, yes, we have a plan, but let's get some action done. As I'm so thankful that the government and AHS is, yes, we have a plan, we still got lots of work to do, but we're taking action today. Unbelievable, unprecedented, as the Premier said. There is nothing like this in the country of Canada. So my grandfather and my father-in-law, who's 82, You know, he's doing actually well, but he's actually probably the exception to a lot of the rules, unfortunately, too, with his post-operative outcomes, where being 700 kilometers away, 800 kilometers away, he's not feeling like he's still getting that support afterwards, the best that it can be. So Sovereign Healthcare is the surgical center, but it's also the pre and the post-op. Our people, Indigenous people, need more supports. So we got the building behind us. It is built completely to the standards of the College of Physicians, AHS, everything. The quality's all there. But we're not driven just by price reduction. We're driven by doing things innovatively. We're doing things by putting us on the map for the province, the country, and internationally. And the only way we're going to do that is by being the best that we can be. So we're not just talking about just the hip surgery and you're done. We're talking about giving Indigenous peoples and all Albertans the experience that I wouldn't say they're lacking, but we should never be satisfied with the status quo. So, you know, when an Indigenous person from high level comes here, they're going to get not just the fancy building with the nice Indigenous pictures, they're going to get a new experience where they're going to have a Dene person talking to them. They're going to have traditional healing and medicine right here in the First Nation, that offered to them as well. And to all Albertans, quite frankly, if they want to go down that road too. So we're not just talking about when we talk about sovereign healthcare, we aren't talking about the politicized aspects of healthcare. It's not, I wouldn't be doing my job as chief of Enoch and honoring 7 generations before me for the people who signed treaty if I didn't live up to the treaty promises. And here in Treaty 6, we have specifically the medicine chest clause. And our people interpret that as universal health care. Bottom line, today we're not talking about all the politicized stuff that people like to get into. So that aside, we feel like we're adding capacity. We feel like we're being team players. We feel like we can add to the team of AHS and the government of Alberta and the physicians and the nurses. We feel like we never had a seat at the table, and for my grandfather and my father-in-law, who are 700 kilometers away, we can add to that experience. This is a long-term vision for us. This is not just one surgical center and we're done. We envision to be partners, and we already are partners with AHS. We have an MOU with them that's written in Nehiyaw Pamatswin. We have a relationship with them, and we don't define sovereignty as just we're doing it our way, and it's the highway. We are sovereign because we have the opportunity to choose who our partners are. And our partners are AHS and the government of Alberta and the government of Canada and private sector. So I hope people don't politicize it too much, because at the end of the day, what we're here to do is to live up to treaty, to live up to universal health care, to live up to 7 generations ago, the ability to do our part with governments and Canadians alike. I get really, really excited. So we only have our first doctor a couple of years ago. And he works in Halifax because he doesn't see an opportunity for him locally to come home to serve our people here in Treaty 6. Well, you know, maybe in 5-7 years, we can have a lineup of doctors who are Indigenous and see themselves now working in this sector, because it wasn't that apparent to them for a long time. And it's not just about being Indigenous. At the end of the day, everybody in this room is treaty. Everybody here has treaty rights. You're all treaty people. And it's for Albertans, it's for everyday Canadians to help you as well, to get a better experience, to reduce the stress on the system, as the Premier and the Minister mentioned, for us to really come to the table and do our part and invest and take risks in the system and to make it more proper. And to me, to do the Canadian thing, which is let's do innovation. Let's not just stand by and wait and talk about the issues. Let's take action. Let's take risks. And I have so many people to thank because, again, it's here on Enoch Cree Nation. Enoch Cree Nation owns it. But I can't do this project without treaty partners and just partners in general. So Government of Alberta I've mentioned. But I call him Mushamo, Dr. Nanji, and Surgical Centers Incorporated, quite frankly, came to the table, and we couldn't be here without them today. So thank you, Dr. Mo, and Dr. Mo's going to speak here in just a little while, but Billy has never run a surgery center before, so we need partners. And, you know, Ballard Consulting, we needed help. We needed help with our RFP. We needed help with capacity and manpower. Our ECDev team with Chase and Dar, we needed help. And they came to the table as a willing partner and helped us get through that intimidating AHS RFP process. But we got through, and it was a fair RFP process. And I'm looking at Francois like he did something bad, but he didn't. It was totally the right thing to do. It made us earn it at the end of the day, which is really great. And, you know, for doctors out there, I get excited for the Indigenous doctors, but whether you're Indigenous or not, you know, our doctors, some of them are leaving, some of them are going to the States, some of them are taking international opportunities, and we do have to get rid of the status quo and give them new opportunities to live, work, innovate, treat patients, put patients first here, and provide a little bit more flexibility in how they do things, and let them be a part of the innovation. So the next person I'll call up is we can't do it without local doctors, and Dr. Mcmullen, I hope you speak towards how exciting this is from the doctor's perspective on working in a little bit of a new environment and how maybe that'll excite us about retaining those doctors and retaining those healthcare individuals of we're doing innovative things right here in Canada, in Alberta, in Edmonton, on a First Nation, and you don't have to leave. Come be a part of the innovation, and you know it's going to take a long time, but I truly think that healthcare sustainability is an actual thing we can achieve, and we do it by thinking outside the box, and by doing it with partners and doctors and getting them excited as well to be a part of this team. So thank you, and I'll invite Dr. Todd Mcmullen, who's an advisor of ours, to speak on the doctor's behalf as well.
Thank you very much, Ogama Morin, and again, welcome everyone. Very excited to be here, and good morning, everyone. And I have to tell you, when I was first, introduced to this project, it was clear to me that this was a once-in-a-lifetime opportunity. As a physician and surgeon at the University of Alberta for over 15 years, I grew up in Alberta. My entire professional career is spent in Alberta. I've seen how the cultural, the geographic, the social challenges impact care for my patients and for my team members around me. And while there have been many excellent programs, I see this Sovereign Health Initiative as truly transformative. And the Cree Nation and Chief Morin's vision for this partnership between the nation and our communities surrounding the nation, I think it brings us together, and I think that it'll bring out the best of our communities when we care for each other. So that's why, again, I'm very excited to be a part of this. Now, I think Chief Morin's comments about this being generational is absolutely important. I think, again, so many people have to come together, and I know my colleagues and other team members will be very excited to join in this. And as things roll forward, very excited, and I think it'll be a focal point for holistic care, and not just for Canada, but for the rest of the world. Now, right now, our collective goal is to focus on the surgical center that we've announced today, but we want to be very clear that it's about Albertans, remote, local. This is for the province of Alberta. And so I think that we can come together, blending the technology and the tradition, to engage all members of our community, including those that have felt previously marginalized by our healthcare system. And so with that point, I'd like to introduce Dr. Mohammed Nanji of Surgical Centers Incorporated to come and talk to us about the project. He's an integral part of this, and very excited to be working with him on this.
Good afternoon. I wasn't sure whether I should say good morning or afternoon, but it's afternoon now. Thank you, Dr. Mcmullen, for the introduction. On behalf of Surgical Centers, it's an honor to be part of today's announcement. It is a big pride and privilege for us to be included in this concept. A very brief history of Surgical Centers. I won't go into all the details. I think very hard to fill the shoes that Chief Billy Morin and the other speakers have said. So very quickly and very briefly, for 34 years, Surgical Centers has provided surgical care on behalf of regional health authorities in Western Canada and we have conducted more than 500,000 surgical procedures. In Alberta, we have been a trusted partner for AHS and the President before that for over 25 years. Through shared ambition, Chief Billy Morin and I brought forward the concept of Land of Medicine Surgical Center of Excellence. It was his idea. We were invited to see if we could work with them and to come to an appropriate solution. When completed, the Land of Medicines will be a comprehensive medical campus and a compelling platform for healthcare delivery with a balance of traditional and Western medicine. We are committed to true reconciliation for Indigenous peoples and feel this is a powerful step forward. Through our partnerships, we hope to transform health far beyond the Muskegee and Edmonton. We hope that this model will go across Alberta and across Canada, and hopefully even further. Together, we hope to create places and spaces that enable communities, health leaders, learners from all backgrounds to use their experiences, strengths, and ambitions to improve health and welcome outcomes. We expect the Sovereign Land of Medicine's Surgical Center to be open about this time next year. Surgical centers will manage and run this chartered surgical facility for orthopedic and hopefully other surgical specialties. Our medical team will work to the same professional standards as those in the Alberta hospitals or other Canadian hospitals with the latest equipment, technology, and medical knowledge. Together, we will continue to be a proven partner in public health care. It is, again, a privilege, and thank you, Dr. I would want to say Chief Dr. Billy Morin or Chief Billy Morin for this opportunity to us, and it's an honor to be here in this great announcement. And thank you, Mr. Premier and the ministers. Thank you.
Nate gave me an honorary Bachelor of Business Administration, so Doctor just gave me an honorary doctorate. Okay. Well, that concludes our announcements and our comments today, but I understand we're going to be taking some questions from the media, so we'll do that at this time, and I'll have our speakers maybe be ready to join me on stage should there be a specific question for yourself as well. Okay.
Thank you, Chief. I don't see any media in person. If you are here, please line up at the microphone. Go ahead. Please keep your questions tight as we're pressed for time. We'll go with one question, one follow-up.
Hi, I'm Sarah Comodino with Global News. I just wanted to ask, with having this center, you're saying you'll be able to get more surgeries done. I think my question will be for either the Premier or the Minister. How will you be able to get that retention or surgeons to be in this facility so we can speed up the process and see those surgeries done?
Mr. Copping will come up.
Start, and we have representatives from AHS here as well, Dr. Belanger. But just so you know that the surgical center, just like other chartered surgical facilities, use the same surgeons that are in the system, right? So and then there's a process being worked out with AHS in terms of assigning surgeons to do the surgeries. Part of the volume that we anticipate an increased volume. And we get that in a couple of ways. One way is this surgical center will focus solely on certain types of surgeries, orthopedic surgeries, and we'll get more efficient at it. So part of it's going to be, the surgeons can actually get more surgeries done in a particular day because that's all they're going to do with the turnover and the combined the teams. Plus, we're actually opening up the number of surgeries, so we'll have a 17% increase overall to be able to do that. And it's not just about more surgeries; it's about the work that we're doing as part of the Alberta Surgical Initiative is how do we speed up the entire process. So and that's looking at ways, and we're working with all partners across Alberta, including the college, including the SCNs, and including the Bone and Hip or the Bone and Joint Institute, of looking at centralized intake, centralized assessment. So surgeons are spending less time doing the assessment and more time doing surgery, which is what we actually need them to do. But Dr. Belanger, do you want any further comments on that in terms of the surgeons?
Just in terms of orthopedic procedures, we know that referrals to surgeons, about 75% of referrals actually do not need surgery. So, you know, to the point that you're taking, getting a screening or pre-assessment, the process is really important. You know, the surgeon, actually we're not short of surgeons. The surgeons are telling us that what we're short of is capacity. So this won't be an issue. The surgeons' allocation will be done through our clinical departments, and they'll be appointed, and they'll come and do the surgeries, and that's not going to be an issue. Thank you.
And do you have go ahead, Premier.
Just to add something, to make that Dr. Belanger's point a little more explicit, we hear from a lot of surgeons, they want more OR time. They want to do more surgeries. Obviously, they have a financial incentive, but they also want to get their patients to have shorter wait times. But there's limited capacity in the current hospital environment. And you've got a lot of different surgeons and a lot of different patients competing for scarce OR time and space. This is part of a broader strategy to build more of that capacity. And those surgeons will, I mean, I'm aware that we have some surgeons here who periodically fly to the United States to do contract work at surgical clinics there, where they are able to do more procedures, generate income, and then they come back and practice here. We want them just to stay here and spend that time caring for Alberta patients. So I think this is a win-win.
And do you have a follow-up?
My follow-up is for Chief Billy Morin. You were mentioning just really how much of a big deal this is. I was also wondering, too, if you're hoping that this will inspire community members or other Indigenous people to pursue a career in medicine, or where do you see this going and inspiring people here?
We have the first Indigenous CMA, Medical Association president, who's Indigenous now, like the first one, and that's Dr. Alika LaFontaine. We need more Alika LaFontaines. Last week, right here, this very room, again, it's not just a surgical center, it's a healthcare system that we want to be a part of. AHS, Covenant Health, Sovereign Healthcare, there's always going to be these interlinkages, and it's not just doctors that we need. We need nurses, we need psychiatric nursing, which I'm so glad McEwen was supported recently with increased funding. It's every single thing across the healthcare sector that we need. Just like any other sector, we're bringing in people from outside the province to come populate these places. But again, for Indigenous peoples, this is our home. And again, there's systematic barriers in these areas to get Indigenous people and students into these places. And those are being knocked down by the great people at U of A, Grant McEwen, NAIT, SAIT, all those institutions. But this takes it another step further, right on the reserve. We already do business and commerce here for many Indigenous peoples, and now they're going to get the opportunity to literally see, feel, touch, live, play, and ultimately work here, right in a surgical center and other medical facilities. So I get really excited about how young people are going to be excited about this. So, you know, our event last week was for youth, 18 to 29. We had 80 Indigenous youth show up here from Treaty 6, 7, and 8 to come stay here overnight and talk about, we didn't get to do specifics on this because this was announced only today, but we were building a healthcare system, and we need you guys to be inspired, and they were, so now we can actually talk about specifically them working here.
Thank you. Operator, can you please go to our next caller?
Shailene Skolsky, CTV.
Hello, thank you so much for taking my question. My question is for the Premier. Premier, my question pertains to the policy your office released yesterday from Jamie Keitel. Why not release the full summary of Keitel's findings? You could have redacted names and ensure anyone involved was kept confidential. Taxpayers paid for that report. Don't they have the right to know what the issues are at the center of this lawsuit?
Yes, thank you. So a summary of the report was released as we committed to, and to release the full report would be to provide confidential information. People who cooperated with Ms. Keitel did so on the basis that the information they provided would be kept confidential, so we have a legal and ethical responsibility to maintain that confidence. while providing a summary of the report and her recommendations for improving the training around workplace respect and ensuring everybody knows if they have an issue where and how to report that. So appreciate her work, but again, she made an undertaking to people that she interviewed that the information she received from them would be kept confidential.
Do you have a follow-up, Shannon?
I do, unrelated, for the Premier and or the Health Minister. When will Alberta move to make the second booster shot available to a wider group? We are hearing from Albertans who had their last shot last fall, as late as September, and now more 7-8 months without a shot. The vaccine is said to wane greatly after 6 months. Why throw away vaccine doses when people want that booster?
Thank you. So this is a decision that is a scientific and medical one. We await advice on that from the National and Alberta Advisory Committees on Immunization. So far, they've not provided that advice, and we certainly would not, as elected officials, improvise an expansion of vaccine eligibility in the absence of scientific advice to do so. So should NACI and the Alberta Advisory Committee on Immunization and the Chief Medical Officer of Health, Dr. Hinshaw, come to the Minister with that advice, we will certainly open up further access to the fourth dose. Right now, I believe it's any Albertan over the age of 70, Indigenous Albertans over the age of, I believe, 60, and people with particular pre-existing medical conditions that make them immunocompromised, for example.
Thank you, everyone. That's all we have time for today.
All right.